Now we are getting into the top two, and I want you to stay with me here because what is coming at number two is something most doctors have never mentioned to their patients. Number two is hibiscus water. That deep crimson flower you may have seen in Tease or dried in the bulk section of a natural grocery store. What the research shows about this flower impact on blood pressure and arterial function in adults over 60 is something that frankly should be common medical knowledge. A clinical trial published in the Journal of Hypertension found that adults with mildly elevated blood pressure who drank 3 cups of hibiscus tea daily experienced an average reduction in systolic blood pressure of 13 points over 6 weeks. That is comparable to the effect of some prescription medications. But without the side effects, without the cost, and without the dependency, hibiscus works through multiple mechanisms simultaneously. It contains compounds called anthocyanins and organic acids, particularly hibiscus acid, that act as natural ACE inhibitors. ACE inhibitors are one of the most commonly prescribed classes of blood pressure medication in the world. They work by blocking an enzyme that causes your blood vessels to constrict. Hibiscus does something remarkably similar through entirely natural pathways. On top of that, a study from researchers at Tufts University found that hibiscus reduced LDL cholesterol, the so-called bad cholesterol, by 22% in adults over 60 over a 12-week period. For preparation, use 2 to 3 tablespoons of dried hibiscus flowers. Steep them in 8 ounces of hot water for 5 to 7 minutes. Allow it to cool and do not add sugar. If you need sweetness, a small amount of raw honey is acceptable. The synergy tip here is powerful. Pair your hibiscus water with a small piece of dark chocolate that is 85% cacao or higher. The flavonols in dark chocolate and the anthocyanins in hibiscus work through complementary vascular pathways. Research from King College London suggests this combination may enhance nitric oxide production, the molecule responsible for relaxing and widening blood vessels, by more than a single compound alone could achieve. If you are on blood pressure medication, already please discuss adding hibiscus to your routine with your physician because it is genuinely potent and your dosing may need to be adjusted. Now we arrive at number 1, the moment I promised you at the very beginning of this video. Earlier, I teased a drink that Harvard-affiliated researchers connected to a 38% reduction in arterial stiffness in adults over 70. The secret lies in how this drink replaces a critical molecule your body has lost. After 60, your natural nitric oxide production declines by approximately 50%. This is one of the primary reasons blood pressure tends to rise with age and why physical stamina drops so dramatically. Number 1 is beetroot water. Fresh or powdered beetroot dissolved in water is the single most powerful evidence-backed vascular tonic available to adults over 60. Beetroot is the richest dietary source of nitrates found in any commonly available food. When you consume those nitrates, your body, specifically beneficial bacteria on your tongue, converts them into nitrites, and then your blood converts those nitrites into nitric oxide. Nitric oxide is like WD-40 for your arteries. When your body produces adequate nitric oxide, your blood vessels relax, widen, and become more flexible. A study from the University of Exeter found that older adults who drank beetroot juice before physical activity were able to sustain activity 16% longer before fatigue. For a 72-year-old trying to climb stairs or carry groceries, 16% is the difference between managing and thriving. Harvard-affiliated research conducted through the Brigham and Women Hospital Research Network specifically looked at arterial stiffness using a measurement called pulse wave velocity, which is a gold standard for measuring how flexible your arteries are. Adults over 70 who consumed beetroot extract daily showed a 38% improvement in pulse wave velocity after just 4 weeks. For preparation, juice 2 medium-sized raw beets and dilute with 8 ounces of water, or use a high-quality beetroot powder. Consume your beetroot water approximately 90 minutes before your most physically active period of the day. The synergy tip for number 1 is the most powerful of everything we have discussed today. Pair your beetroot water with vitamin C. Orange juice, kiwi, or bell pepper consumed alongside beetroot dramatically enhances nitric oxide stability, meaning the nitric oxide your body produces lasts significantly longer in your bloodstream. If this video gave you something valuable today, please take a moment to like this video, subscribe to the channel, and turn on notifications so you never miss an important health update. If you personally relate to the frustration of sluggish circulation, high blood pressure, or fading energy as you age, please comment below and share this video with anyone you know dealing with these issues. Finally, I would love to know where you are watching from, so please leave a comment with your city or country down below to build our community. I am Dr. Eric Berg, DC, and I will see you in the next one. Symptom number 2 is sudden confusion, trouble speaking, or trouble understanding. This one is terrifying when it happens, and it is often the symptom that frightens bystanders the most. Suddenly, mid-sentence, you cannot find words. You know what you want to say, but the words will not come out, or the words come out jumbled, slurred, or completely wrong. Or someone is talking to you, and you genuinely cannot understand what they're saying, even though you can hear them perfectly. This is called aphasia. It affects language comprehension or production. It is called dysarthria, when the words come out slur like your mouth is not cooperating. Both are caused by ischemia, reduced blood flow to the language centers of the brain, which are typically in the left hemisphere. A meta-analysis in Circulation covering over 86,000 patients found that presenting with aphasia or dysarthria was associated with 45% higher long-term stroke risk. It accounted for nearly 20% of all subsequent strokes in that population. That is not a minor symptom. That is your brain waving a big red flag the size of a building. Here is what makes this symptom especially dangerous. It can be subtle. You might just feel slightly confused. Words might be slightly harder to define than usual. You think you are just tired or distracted. Do not rationalize it. Sudden onset is the key word here. If it came on fast out of nowhere, that is not normal for you. That is the signal. Please remember that while we explore these treatments, this video is for educational and informational purposes only and is not a substitute for professional medical advice. You should always consult a licensed doctor for proper diagnosis and treatment of any condition. Symptom number 3 is sudden trouble seeing out of one or both eyes. This one gets missed more than almost any other warning sign, as I said previously, and the research confirms it. Sudden vision changes, including a curtain or a shade dropping over one eye, blurry or double vision, or losing part of your visual field, are classic signs of stroke or TI affecting the visual pathways. Transient blindness in one eye, where one eye is completely dark or blurry, is a particularly important warning sign that typically indicates that the carotid artery on the same side is either narrowed or is plaque that is breaking off and traveling toward the eye. That same plaque can travel to the brain. A population-based study found that visual symptoms account for almost 53% of strokes that are missed by the standard FAST mnemonic. More than half of missed strokes involve vision. This is why researchers developed the expanded FAST mnemonic, which stands for balance, eyes, face, arm, speech, and time. This reduces missed strokes from 14% down to 4.4%. The eyes component exists specifically because visual symptoms are that common and that important. So, if you or someone near you loses vision in an eye, sees double, or notices that part of their visual field has gone dark, even for 30 seconds, that is a medical emergency. Symptom number 4 is sudden trouble walking, dizziness, or loss of balance. This symptom points to a different part of the brain, the posterior circulation. We are talking about the brainstem, the cerebellum, the regions that control balance, coordination, and basic life functions. Posterior circulation strokes account for 20% of all ischemic strokes, and they are historically the most frequently missed and misdiagnosed. The symptoms can look like an inner ear problem, severe dizziness, vertigo, the room spinning, suddenly unable to walk in a straight line, stumbling, falling, or feeling like you're on a boat. Here is how to tell the difference between a benign inner ear issue and something neurological. Posterior circulation TI, or stroke, almost never causes isolated vertigo alone. It comes with other symptoms. Double vision, slurred speech, weakness on one side, numbness around the mouth, or difficulty swallowing. If the dizziness is accompanied by any of those other symptoms, even mildly, that combination is a neurological emergency until proven otherwise. A study on FAST found that gait imbalance or leg weakness was present in 42% of ischemic strokes that were completely missed by the standard FAST checklist. These are not rare edge cases. These are real patients real lives that are changed, real emergency rooms where they were sent home and had full strokes. Do not let that be you or someone you love. Symptom number 5 is a sudden severe headache with no known cause. This is the most dramatic warning sign on the list, and in some ways the most urgent. We are not talking about a tension headache from a bad day at work. We are talking about a migraine that you have never had before. We are talking about what neurologists call a thunderclap headache, a headache that reaches its maximum excruciating intensity within seconds. People describe it as the worst headache of their life, like being hit in the back of the head with a bat. That kind of headache is the hallmark of a subarachnoid hemorrhage, bleeding around the brain from a ruptured aneurysm. This is an emergency until proven otherwise. And here's the part that keeps neurologists up at night. In 10 to 40% of subarachnoid hemorrhage cases, the major bleed is preceded by a sentinel headache, a smaller little warning leak that happens 2 to 8 weeks before that catastrophic rupture. Patients describe it all the time, but doctors sometimes dismiss it as a migraine. Research shows that misdiagnosing a sentinel headache results in a 4-fold increased likelihood of death or permanent disability. 4 times more likely to die or have permanent disability because the warning was missed. If you have a headache that is sudden, severe, and different from anything you have ever felt before, go to an emergency room. Do not take ibuprofen and go to sleep. Get a CT scan. That headache could be saving your life if you listen to it. Now, I want to address something I hear all the time. People say the symptoms went away. Does not that mean they are okay? No, I want to be as direct as possible because this misconception kills people. When symptoms resolve on their own, that is called a TIA, a transient ischemic attack. The old definition said a TIA was any stroke symptom that resolved within 24 hours. Doctors now know that definition was dangerously incomplete. Modern MRI imaging shows that many patients whose symptoms resolved in minutes already had real brain damage, small areas of dead tissue that never recovered. The American Heart Association now defines TIA based on whether there is actual brain injury on imaging, not how long symptoms last anymore. What this means for you is simple. Even if the symptoms are completely gone by the time you get to the hospital, you need to go, because the risk of a full stroke in the next 48 hours is real. It is significant, and it is preventable with the right treatment. The American Heart Association recommends evaluation within 24 hours of symptom onset, ideally with MRI brain imaging and heart rhythm monitoring. The treatment after TI includes medications to prevent clotting, statins that stabilize the plaque, and in some cases, procedures to open up these narrowed arteries. And when all of that is done promptly, the 90-day stroke risk drops by up to 80%. To reveal what I teased earlier, the specific symptom that standard medical tests miss more than half the time is sudden visual changes, which is why the FAST acronym was created to replace the old FAST test. By adding balance and eyes to the checklist, doctors catch the posterior circulation strokes and visual pathway blockages that otherwise slip through. Let me paint you a picture of what that looks like on the other side. Imagine you notice one of these 5 symptoms. You do not wait. You call for an ambulance. You get to the hospital. You get the right imaging, and the doctors find a narrowed carotid artery. They put you on the right medications. They monitor your heart. They find atrial fibrillation, a heart rhythm disorder that is responsible for a huge percentage of strokes. And they treat it. You go home. You are not paralyzed. You are not in a wheelchair. You are not struggling to find words for the rest of your life. You go home because you paid attention. That is what recognition does. That is what acting on these 5 symptoms can mean for your future. If you personally relate to the fear of stroke or have a family member who has experienced a TIA, please comment below and share this video with anyone you know dealing with heart or stroke risks. Please take a moment to like this video, subscribe to the channel, and turn on notifications so you never miss an important health update. Finally, I would love to know where you are watching from, so please leave a comment with your city or country down below to build our community. I am Dr. Eric Berg, DC, and I will see you in the next one.